Hey, this is Russ. Time for another knee patient. Yeah, somebody other than me. He may be our last knee patient unless you guys send me your information. Okay, and if you want to do that and be featured on Russ is Right to tell us a little bit about how your knee journey has gone, send it to contactrussisright@gmail.com. All right, I'll put a link in the description below as to the video you can watch and how best to do all this stuff. Okay, so I'm just going to read his email like I have been in the last couple ones, because this way I won't miss anything, and I'll throw in some of my commentary as I usually do. All right, so patient Adam, he says, many thanks for all your great knee YouTube videos. Well, thank you very much. I have greatly relied on your information, as well as Tony Maritato from Total Therapy Solutions and Dr. Luke Peterson from Knee Replacement Therapists on YouTube. Oh, I watch those guys too. You guys should too. All right. I value your genuine honesty about the whole process. The only other real genuine information I got was from patients in the therapy room and some past patients who will talk about their experience, as I feel most of them want to forget it and not talk about it and try to move on. That's probably true. Yeah, people just want to move on and get over with this thing, right? So I had my total knee replacement done on October 26th of 2020. And then I had a total left hip replacement on December 17th of 2020. Wow, this guy's gone through a lot. I am 61-year-old male from Minnesota. I needed both surgeries as I was having a difficult time walking and sleeping prior to surgery. Yeah, many of us do. My surgeon took one look at my knee and hip x-rays and said that there wasn't anything to talk about and the surgeries needed to be done. Okay, so he is in desperate need to get it done. All right, good. Well, that's not good. Good as far as moving forward, okay? Prior to my surgery, I was told that knee surgery is tough and painful. My surgeon said that the first month after you have it, you will think that the surgery was a mistake. Yeah, I'm beginning to think it may be more than just a month after. You may be continually thinking that, right? Others told me just make sure and do all your therapy exercises. He asks, what would you tell someone who asks about your knee replacement? Yeah, and you know what? That's a good question, because I don't know what I would tell somebody. I know that if you need to get it done, I would say, go get it done. But if they ask me, was it worth it? I can't really answer that question still. I'm still debating if it's still worth it. Okay, anyways, he says, one day after my surgery, I started on the CPM machine, which is the continuous passive motion therapy. And that was delivered to his house for 4 to 6 weeks of use. Okay, he was told to use it 3 hours a day, setting the extension optimally at 0 and deflection to go to 120. Okay, that would be the optimum things they want you to do. Okay, that's pretty standard. That what people tell you. I was told to go on a lower setting if I felt pain, and to stop if it was very painful. All right. Well, I wasn't feeling much pain since, and let me read this again. While I was not feeling much pain since, the pain meds from surgery had not worn off. So after an hour of use, I blew through the top of the stitches on my top of my knee. I could not stop the bleeding, so I needed to go to the emergency room. Okay, this is not good. Okay. The blood also flowed down my inside of my legs to my feet. My feet swelled and looked like the penguin's feet from Batman. Okay, pretty puffed up. So for me, the jury is out on the CPM machines. I did go back to it 4 days later and had no problems, and used it for the next 6 weeks, 3 hours a day. 3 hours a day is a long time on your back. I would love a comparison video comparing the jazz to the CPM. Okay, let me talk a little bit about this here. Now, if you can't feel the pain, I can see how you can just keep pushing the CPM machine, because you don't think it's hurting, but you're pushing it past where you should be. Okay, and that was enough to. Looks like he tore off the stitches. Okay, now that would be really bad. Okay, I have seen a photo of some of these stitches who got blown out, and it looked really bad. Okay. Yeah, you got to take that thing slowly and carefully. There's no real way you can go that hard that early on in the stage of using the CPM. Okay, I know that I was hurting when I pushed too hard, And so I went as far as I could, and then I didn't push it any further than that. So I would always start low and just keep increasing a little bit and a little bit and a little bit. I would never start straight out. I wouldn't put it at like 90 degrees straight out. I would start at maybe 70 and work my way up. Okay. Now, I will tell you this, that I don't believe that the numbers that they show on the CPM machine is the true flexion number, because there is some give and take when you're moving, because your tissues are compressing and moving and stuff. There's some differences there. So even if it says 90 degrees, or the number says 90 on the CPM, I don't think you're really getting true 90, because even though the machine might show it to be at 90, you're not truly at 90. Same thing with the jazz unit. If you think that, hey, you're looking at the jazz unit and says, hey, that's 90 degrees of flexion, you can see it bend at 90 degrees. Well, there's some tissue there that absorbs some of that, right? So you're not truly at 90, right? So, and another thing with the jazz versus the CPM, the jazz is not continuously moving, all right? It's something that pushes you and holds you there the entire time, whereas the CPM is moving up and down all the time. It's going from an extension to a flexion, all right, and back to an extension to a flexion. It just keeps moving. The CPM is you dial the knob in. Let's say you dial it in, and maybe let's say you're getting 70 degrees or whatever it is. It stays there until you release it. Okay, so that's the biggest difference between the jazz and the CPM. Jazz stays where it's set for. CPM keeps moving constantly. Okay, and you can change the rate of movement on a CPM machine. You can go fast, you can go slow, whatever rate you like. Now, I was told by the therapist in the hospital, okay, she told me, go slow on the CPM machine. You don't want to just keep pumping this quickly. So she puts it on the slowest setting and moves it slowly. All right, I don't know if she's right or wrong, but that's what she told me to do, okay? All right, back to him. I also use plasma flow leg wraps. I was told I need to wear them 24/7 for the first 2 weeks. They do take some getting used to during sleep, but as you said, sleep is very hard to come by for the first 2 months. Yeah, a lot of us have a hard time sleeping. Okay, I do believe it's a good product, he says. I wore the TED compression socks, and I am still wearing them. In the beginning, my feet would cramp while lying in bed, and I would feel like I had a small little animals fighting in the bottom of the stockings. But I am past that, and they are very helpful in ridding your feet, ankles, and leg of fluid. Okay, I had to wear compression sock too. Okay, I wore that quite a long time, actually. I actually wore it to physical therapy too for quite a while, as I remember that. And it's kind of weird because I only have it on one leg. So I would go to physical therapy in shorts, because keep in mind that I had this, I had my thing done in September, and it wasn't really that cold yet. It was still kind of warm. I would wear shorts with a compression sock on one leg, and of course, the knee is really puffed up. It looked like a softball. It was pretty big. Okay. So anyways, I always thought it was kind of weird looking at me coming in with a walker with one compression sock and shorts. Weird sight. Anyways, back to him. He says that he did cut the stocking toes, and so that he even showered with them on, since hip replacement restrictions do not allow you reaching down until the first month after surgery. So it's kind of hard to take a shower. You're not supposed to get your incisions wet, okay? So until everything's sealed up and ready to go, kind of hard to take a shower. And even when you do, what we used to do is we would wrap my knee with saran wrap to make sure it does not get wet, all right? So back to him. I always do all my therapy exercises every day. For me, the biggest challenge is reaching your range of motion when there is still a lot of swelling and fluid in your knee. The fluid feels like a restrictive strap or brace. I agree with that. My therapist suggested that I try BFR blood flow resistance training during one session. I don't know what that is. That was a mistake that made my muscles from my knee to my armpit feel very tight and painful for about a month. I received an MUA during my hip surgery, and that really helped and loosened all my right side muscles. I did try your gua sha scraping technique. Okay, let me show you that. This is what I use, and it's basically for my trigger finger thing. Okay, remember this thing? All right, so what I do is okay, it's on my right hand, all right, but I'll show it on the left because it's easier. I just scrape it this way. Okay, you can hear it. Can you hear that? So I just basically scrape it. And as an update to me, since we're talking about this, is this helpful? Now, I got a message from another viewer. She messaged me on the video I did. And she said that she bought one. I don't know if she bought one because of me, but I think she was searching for gua sha scraping, and she ran across my video. Okay, and I don't know how well she's doing with it, but she bought something too. So I'm curious from her if it helps her. Okay, so hopefully she'll write back. But has it been helping me? I've been doing this for a couple weeks now. Let me tell you that. Wrong hand. Okay, it's this hand here. You can see I'm moving fairly well. This helps me when I'm doing it. When I stop doing it, okay, after a little bit of time, the trigger finger comes back. So it does not seem to be a permanent solution for my trigger finger. Okay, it is a temporary thing. All right, and literally when I do this on my hand, yeah, I'm able to move my fingers, and I still use this thing. Okay, this is the thing I fashioned myself. I put this over here, and I sleep with this on, because if I don't, my finger won't keep straight. It'll tend to bend, okay, and it's hard to move it back. So this just helps me from bending it, and I wear this all night long, okay. When I go out, I use this one. Okay, this is the one that I bought on Amazon because it just looks better. I mean, it doesn't look like I fashioned something weird. And I wear this little brace when I'm out and about and I need to have some type of thing on my finger. So the gua sha thing is helping me, but it only helps me temporarily. It's not a permanent fix, unfortunately. I think that trigger finger will probably have to keep going. It's not going to be done. All right, anyways, he did try the gua sha scraping technique to get rid of his tourniquet lump on the right side of his right knee, and it works, he says. He used a butter knife and coconut oil. Okay, yeah, that's what my wife said. She says, why do you need to pay money for this? Like, well, can't you just use a butter knife? Yeah, apparently he does, and it works. All right, yeah, this is just a little fancier, okay, but it's basically the same thing. I did get better and was walking a mile every day and riding a stationary bike for 15 minutes every day before hip surgery. I'm now 2 weeks post hip surgery, and things are getting better every day. Please keep your YouTube videos going. They are much needed and appreciated. Unless you have not had surgery, it is hard to know what people go through. I, like you, have had a hard time watching people struggle with therapy. I also did not take oxy medication after surgery. Oxy meds make it very hard for me to function. I say too many unthought stupid things. Okay, so it really affects him. Yeah. Please feel free to use my above information for your knee patient YouTube videos. Thanks again. And he says that his extension currently is at 0. Good for him. And he uses a 0-degree knee by bone foam, mycomfortmd.com. Worth the money since it's used 3 times a day for at least 10 minutes. Okay, I'm not sure what that is. Okay, flexion is about 120. 10 supine heel slides, holding at least 3 of them for a minute. So he's at 0 and 120. Okay, so good for him. And it sounds like his hip is doing well too. So that is patient number 7M from Minnesota. And again, if you would like to give me some updates on how you're doing, send me the email at contactrussisright@gmail.com. Okay, thanks again. And hopefully you guys liked what you saw. If you did, just go ahead and hit that like button. Hit the subscribe button too, so you can see more goodies from me. Talk to you guys next time.